We all experience shortness of breath occasionally, whether after a strenuous workout or a moment of panic. But what if this breathlessness was directly related to your body's position? This is the intriguing case with positional dyspnea, a condition where breathing becomes labored in specific postures. Two less common yet fascinating types of positional dyspnea are Platypnea and Bendopnea. These conditions can provide crucial clues about underlying diseases, often involving the heart or lungs. Understanding these conditions can be crucial for accurate diagnosis and timely intervention. In this exploration, we'll delve into the intricacies of Platypnea and Bendopnea, unraveling their causes, mechanisms, and clinical significance. By understanding these conditions, healthcare professionals can better serve their patients and improve healthcare outcomes. Imagine feeling short of breath when you stand up, a sensation that eases when you lie down. This counterintuitive experience is the hallmark of platypnea. Derived from the Greek words platy, flat, and pnea, breathing, platypnea describes the unusual symptom of dyspnea that worsens when upright and improves when lying down. This is in stark contrast to the more common orthopnea, where breathing difficulty arises when lying flat. Platypnea often indicates an underlying cardiopulmonary condition, often one that creates an abnormal blood flow pattern within the heart or lungs. Recognizing platypnea is crucial, as it can be the first sign of a serious medical condition that needs immediate attention. Early diagnosis can lead to prompt treatment and potentially better outcomes for patients. Platypnea can arise from a variety of conditions, each affecting the cardiopulmonary system in unique ways. One such condition is hepatopulmonary syndrome, a complication of liver disease. In this condition, dilated blood vessels in the lungs, triggered by liver dysfunction, disrupt the normal oxygen exchange, leading to platypnea. Another cause is a patent foramen oval, a small opening between the heart's upper chambers. This opening, present at birth but usually closed in adulthood, can, in some cases, allow blood to bypass the lungs, leading to low blood oxygen levels and, consequently, platypnea. Other contributing factors include pulmonary arteriovenous malformations, kyphoscoliosis, and interstitial lung disease. Each of these conditions can disrupt the normal mechanics of breathing, leading to the characteristic positional dyspnea seen in platypnea. Platypnea often presents with a companion symptom known as orthodeoxia. This term, meaning upright and low oxygen, describes a drop in blood oxygen levels upon standing. This dip in oxygen saturation further exacerbates the shortness of breath experienced in platypnea. The combination of platypnea and orthodeoxia, termed platypnea-orthodeoxia syndrome, presents a clearer picture for diagnosis. This specific symptom pairing helps healthcare providers narrow down the potential causes and focus on conditions that lead to both positional dyspnea and compromised oxygen absorption. Recognizing and understanding this pairing is crucial for effective diagnosis and management of the underlying condition. Treatment often involves addressing the root cause, which might include managing liver disease, closing a patent foramen oval, or addressing other anatomical abnormalities. Section 5. Bendopnea dyspnea that bends you over. While platypnea involves discomfort when upright, bendopnea manifests as shortness of breath upon bending forward. This sensation typically subsides when the individual returns to an upright posture. Bendopnea, a relatively newly recognized condition, is often an indicator of heart failure or other conditions affecting the heart's ability to pump blood effectively. When bending forward, pressure increases within the abdomen, impacting the heart and lungs. In individuals with heart failure, this increased pressure can overwhelm the already compromised heart, leading to the characteristic shortness of breath. Recognizing bendopnea, though less common than platypnea, is crucial as it can be a subtle yet significant sign of underlying cardiac or pulmonary dysfunction. Early detection allows for timely intervention and potentially better management of the underlying condition. Section 6. Causes of bendopnea from heart failure to lung disease. While the exact mechanisms of bendopnea are still under investigation, several conditions are commonly associated with it. Heart failure, a condition where the heart cannot pump blood effectively, is a leading cause. The increased abdominal pressure upon bending can further strain the failing heart, leading to bendopnea. Other cardiac conditions, such as constrictive pericarditis, which is inflammation of the sacs surrounding the heart, can also contribute to bendopnea. This inflammation restricts the heart's ability to expand and contract properly, leading to breathing difficulties, particularly when abdominal pressure rises. Beyond cardiac causes, bendopnea can also be associated with massive ascites, severe obesity, and chronic obstructive pulmonary disease, or COPD. These conditions can all limit the diaphragm's movement, essential for breathing, exacerbating shortness of breath when bending forward. Section 7. The importance of history-taking, connecting the dots. The diagnosis of both platypnea and bendopnea hinges significantly on a detailed patient history. Asking the right questions about the nature of their shortness of breath, specifically when it occurs and what relieves it, can provide crucial clues. Doctors should inquire about any other symptoms, such as chest pain, fatigue, or swelling in the legs. This detailed history, combined with a physical exam and appropriate diagnostic tests, helps paint a clearer picture of the patient's condition. Medical students and new doctors should be particularly attentive to these positional variations in dyspnea. These seemingly simple observations can provide a wealth of information, guiding them towards the correct diagnosis and management plan. Section 8. Conclusion. Positional dyspnea, a diagnostic clue. Platypnea and bendopnea are not just medical curiosities, they are valuable clinical indicators. They serve as important reminders that dyspnea is not always straightforward and can present in unusual ways. Understanding the mechanics of these conditions, their underlying causes, and their clinical implications is vital for any healthcare professional. By paying close attention to a patient's description of their symptoms, particularly the positional nature of their shortness of breath, healthcare providers can unlock crucial diagnostic clues. This, in turn, facilitates early diagnosis, prompt treatment, and ultimately, better patient outcomes. As we continue to expand our understanding of these conditions, we can further refine our diagnostic and treatment strategies, offering hope and improved quality of life for individuals experiencing these unusual yet telling forms of dyspnea. Section 9. Disclaimer. This article is intended for informational purposes only and should not be considered medical advice. The information provided should not be used for self-diagnosis or self-treatment. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.